It's nothing to sneeze at, the dog flu. It's rearing its ugly head again, and your dog could be at risk. The dog flu, also called canine influenza virus, or CIV, is a respiratory virus that can affect almost any dog. In fact, H3N2, that is the strain that arrived here from Southeast Asia in 2015, will affect almost any dog not vaccinated because there's no immunity to H3N2 in the United States. It's highly contagious, especially in environments where dogs are in close proximity with one another. Everything from dog shows and dog events to doggy daycare, even grooming facilities, of course the dog park, the dog beach, even those quick to nose greetings during walks. Some symptoms that your dog might have the flu include coughing, sneezing, feeling just yucky like people might with the flu, a clear nasal discharge, difficulty breathing, and loss of appetite. A coughing dog you might think has kennel cough or Bordetella or the canine influenza virus. Certainly these things do happen in dogs, so it's really important for your veterinarian to test to understand exactly what your dog has. Making things even more complicated, some dogs actually get this virus. The good news for those dogs, they have no symptoms whatsoever. They feel as good as they can be and they're ready to chase squirrels, but they are still contagious. In fact, as contagious as a dog with symptoms. Now, what really can happen, and happily it doesn't happen often, is that some dogs get so sick they get pneumonia, and ultimately some of those dogs may not make it. About 3 to 5% of dogs with canine influenza virus succumb to the flu. Now that's a low percent, but you don't want it to be your dog. There are only 2 ways to protect your dog from the dog flu. Number 1, your dog is absolutely antisocial, never around any other dogs. And some dogs are just that, and that's fine, but even then, there is a possibility that you can pet a dog that is spreading the virus. You can help that dog along by bringing the virus on your shoes, on your pant leg, back home to your dog. That is truly a possibility with H3N2. Of course, the only other way is vaccinate. Now, do understand that your dog gets an initial shot and then 2 to 4 weeks later must get a booster. So, if you're going on vacation, think in advance. Your dog gets the initial shot and then a booster several weeks later. So, it's important for the canine flu vaccine to plan in advance. So don't wait, vaccinate. Contact your veterinarian to at least ask if vaccination is right for your dog. Learn more at doginfluenza.com. I'm Steve Dale.